have called for an increase in budgetary allocations as 90% of health sector domiciled or is domiciled at a community level. The government has been challenged to step up its activities to increase financing so as to reduce the burden. George Maringa with that.
That the health sector in the country continues to lag behind in the budgetary allocations is not a secret. That is, if the figures in the current budget are anything to go by. In the 2023-2024 financial budget, Kenya's Ministry of Health received an allocation of 141.2 billion shillings. This allocation represents 11% of the total annual budget. This year's percentage is down from 146.8 billion Kenya shillings that was allocated in the 2022-2023 financial year. This is a sharp contrast to the famous Abuja Declaration. In the year 2001, AU member states set a target of allocating at least 15% of their budget annually to the health sector. It therefore means that development partners and donors have been left to cater for the deficit. However, there is a problem.
Our partners like Global Fund and even PEFA are now waking us up and saying, you guys, we may be leaving soon. And for us to leave, for you to continue, you must strengthen your systems.
But even as that happens, there needs to be insistence on core issues in running the health sector.
The health sector needs more financing, but a huge proportion of our investments need to go to health promotion, ensuring that we are preventing diseases.
The stakeholders who met under the theme Advocacy for Sustainable Health Financing towards Community-Led Response opine that proper financing, community health provision would bridge the health services access gap by far to rich and vulnerable populations.
The way to do that is to really look at, out of the 315 primary care networks needed across the country, how many are established. Out of those established, how functional are they?
It has been argued that allocation of resources has been hampered by poor governance and lack of accountability in the use of the resources allocated to the healthcare sector. Stakeholders argue that the allocation model needs to change.
Most of our budget, it's like lump sum, public health or medical or preventive. Within that preventive, we need to see a separated budget lane and with the cost. And that cost must be informed by the need. Like, for example, under HIV, what is our need? What is it that we have? Where is the gap?
The result of poor financing to the health sector has seen many Kenyans who live below the poverty line having to spend out of pocket for their health.
Imagine if we could cut the occurrence, reduce the occurrence of diseases like diabetes, high blood pressure, cholera, diarrhea, malaria, HIV to be 1 out of 10. Then we can afford. But at the current rate, I can tell you, it's only a matter of time before we realize that our health system cannot break even.
This, even as President Dr. William Ruto seems keen to change the tides in health insurance.
Every Kenyan, even those who today cannot afford nothing, they will have a health insurance. The people who are paying 500 will come down to 300.
When all is said and done, reducing donor dependence should inform the formation of the next financial budget. The government also needs to encapsulate all vulnerable groups across the country, even as it should make accountability an ingrained process of governance with the necessary checks and balances and offenders brought to book. George Maringa, TV 47.